Bismillahirrahmanirrahim. Assalamu alaikum students. Today I will be discussing with you an important topic of pathophysiology, that is cardiac cycle. Okay students, in simple words, cardiac cycle means sequence of events which takes place during the contraction and relaxation of atria and ventricles. Okay, we can simplify it in another manner, in very simple words. Alternate contraction of atria and ventricles is called cardiac cycle. Very simple students. Alternate contraction of atria and ventricles is called cardiac cycle. Students, there is a point here. Why we have not mentioned relaxation of atria and ventricles? In cardiac cycle, both contraction and relaxation occurs, but in definition we have identified alternate contraction of atria and ventricles. Students, this is because cardiac cycle is actually a change in pressure gradient in atria and ventricles. There is a change in pressure. Contraction is always an active process, whereas relaxation is a passive process. Okay? Contraction of both atria and ventricles need special message from the SA node and AV node. On the other hand, relaxation of atria and ventricles do not need any special message from SA node and AV node. It's just a passive process. When contraction occurs, it will always be followed by a relaxation phase. Okay? Now, in simple words, cardiac cycle can be defined as alternate contraction of atria, both atria, right and left, and ventricles. This is called cardiac cycle. Students, cardiac cycle can be divided into two main events. Number one, systole. It is pronounced as systole, and diastole. In systole phase, there is contraction. This is contraction. And diastole, it is relaxation. This one. This is contraction. This is relaxation, and this combination of contraction and relaxation is called cardiac cycle. Okay? Now, systole event, that is the contraction phase, it is divided into two events: atrial systole and ventricular systole. Okay students, in atrial systole, both the atria contract, and this contraction forces the blood into the ventricles. Okay students, in atrial systole, both atria contract and blood is pushed into the lower chambers called ventricles. Now, ventricular systole. Students, in this phase, blood is pushed to the lungs and rest of the body. Okay? In ventricular systole, both ventricles contract and they push the blood into the lungs for oxygenation and rest of the body for nutrition. Okay, students? Now we move towards diastole. Again, diastole, which is a relaxation phase, it can be divided into two events: atrial dystole and ventricular dystole. Students, in atrial diastole, blood from large veins of the body that are superior vena cava, inferior vena cava, it goes back to the atrium. Okay? Blood from larger veins, that is superior vena cava and inferior vena cava, it reaches the atrium. Students, in ventricular diastole, this is ventricular diastole phase. Both the ventricles, they relax, and as a result of this relaxation, blood from aorta, it reaches back to the ventricles. Okay? Now you can see that in systole phase, the flow of direction of blood is from heart towards the body parts. Whereas in diastole phase, there is a movement of blood from the body parts towards the heart. Okay, students? Now, in systole phase, there is increased pressure as compared to the other blood vessels. And it is because of this pressure that blood is pushed away from the heart towards the body. Okay? Whereas in diastole phase, there is decreased pressure in the atria and ventricles. As a result, the blood reaches back into the chambers of the heart. So it was very brief about cardiac cycle. Students, thank you very much.